Hey everybody, I'm Dr. Perkins, a board certified OBGYN, and we are here today to talk about how to get rid of a yeast infection while pregnant. This topic is so important today because pregnancies are so common. And while we go through this, our bodies change in so many different ways that it's important for us to know how common they are. Can yeast infection harm your unborn child? Know how the yeast infection pill may affect us when we're pregnant. Know the importance of the effect of yeast infections while breastfeeding, and how to prevent yeast infections in pregnancy. So we're talking about all this and more today, so come on in, let's chat. Yeast infections are so common in pregnancy. Research shows that approximately 20 to 30% of females may experience one in each pregnancy. Know that our bodies are in a state of not being at its best in pregnancy. And I know it sounds crazy because I tell my patients all the time that pregnancy is a disease state. And yes, we have something beautiful that comes out of it, but your body is not as strong. It is not able to fight things as it normally would and as easily as it normally would. And so because of that, you're more vulnerable to getting infections and problems in pregnancy. And one of those is a yeast infection. And so I've talked on my channel about yeast infections quite a bit, so you can check out the videos that are there. And with that, you will get lots of information about what the yeast infection is, how to treat it. I even have a video that I walk through the treatment options and show you what they're like. And so go ahead and check out the other videos right here on this channel. Now, yeast infections is a fungal infection. And so with that, the vaginal space becomes very irritated and not very fun. And so if you have an infection, know that it's common and know that you're not alone, and it's very easy to be treated. Now, while you're pregnant, if you have a yeast infection, a very common thought is, can this affect my child? Like, what is the risk to my pregnancy? And what should I do about this? Know that I want you to breathe for a second. Yeast infections will not affect your unborn child, okay? They're infections that affect you the most. You're the one that will feel the symptoms. You will have the change that happens in the vaginal space that is very uncomfortable, but your child is protected. And it's protected by several things. The first is that your baby is being grown in a uterus, and that uterus has a cervix that is pretty tightly held together the entire pregnancy, blocking your baby from things from the world, including yeast and other bacteria that lives in the vagina normally. Know that there are even more levels of protection to your baby because the cervix has a plug that we call the mucus plug. And what that is a blob of mucus, literally mucus, that sits right between the baby and the cervix itself, right on top. And essentially, it helps to prevent things from the outside world from passing to your baby. And mucus does a very, very good job at doing that. And so regardless of the types of infections that you're having in the vaginal space, the likelihood of them passing and transmitting through the cervix beyond the mucus plug and to get to your baby is very slim. There's another level of protection again. And so I love the way that our female bodies work, and the way we protect pregnancies is pretty remarkable. The third level is that your baby is living in a sac. That sac helps to protect and prevent things from passing into the space where your baby is actually living. And so when we think of breaking your water, we're thinking about that sac rupturing. That's exactly what happens. And once it ruptures, anything from the outside world can now pass on to your baby. And so usually that rupture or that damage to that cellular thick sac that is protecting your baby, this happens later on in pregnancy, in labor, when it's time to deliver. It usually doesn't happen earlier in pregnancy. And so with that, there are so many different levels that are there protecting your baby. So no worries. If you have a yeast infection at this time, the likelihood of you affecting your baby or this infection affecting your baby is very, very slim to none. However, I will state that because of the discomforts that yeast infection may cause you, it is recommended that you get treated if you were to have this infection. If you are currently not having any symptoms and you have a yeast infection, you really have the option of getting treatment or not getting treatment, because yeast infections are most uncomfortable for you and doesn't affect your baby as much. So how do you treat yeast infections in pregnancy? Well, very similar to how we would treat them when you're not pregnant. And so when you're not pregnant, you have the option of using something over the counter or prescribed that goes in the vagina, or you can be prescribed a pill that you would take by mouth and that clears your infection. 2 common ways to treat, completely okay. When you're pregnant, your provider can give you a prescription specific to those who are pregnant that are very similar to those when you're not pregnant. So for instance, you can still have a vaginal treatment with a suppository or a cream that is completely safe in pregnancy. However, there are versions of this cream that are prescribed and are not found over the counter that would be best for you in a pregnant state. So if you do have an infection that you think is a yeast infection and you are pregnant, please do see your provider so they can confirm and they can give you the most appropriate treatment by prescription that will take care of this infection. So you might be also wondering, well, can I take a pill? Sometimes as providers, we may give you additional pills and you might have this in your bathroom ready to go. But I'll caution you to not use the pill, especially in early pregnancy. And the reason is the risk to your pregnancy and your baby may be higher during that state. The time frame that this is most important for really is in the first trimester. That is the first 14 weeks of your pregnancy. And this is because in this time of pregnancy, your body is actually going through the most changes. But more important to that is that your baby is developing all the organs and the important structures that will over time grow and get bigger, but they're developed in the first 10 to 14 weeks of pregnancy. And so whenever we take the pill to treat yeast infections, this pill is going internally and is systematically going through your body, going through the placenta, going to your baby, and can affect the growth of these organs internally. And so we don't want to disrupt any potential growth of your little human being inside. And so because of that, I want you to take caution and to stay away from the pill in early pregnancy. Now, there are really, really exceptional outliers where it is important when we look at the risk and the benefits to get that treatment. But in general, we want to avoid taking the pill. In your 2nd and 3rd trimesters, it is okay for you to use this pill to treat a yeast infection. But as a physician myself, as a female myself, I always recommend that you treat a yeast infection in the local area. That means using the treatment in the vagina because that's where the infection is, rather than taking the pill where the pill goes through your stomach, goes through your liver, goes through your blood, hits all your organs internally, including the vagina, but it's more systematic. And so if you are able to avoid this, really treat vaginally right in the area where you have the problem. I find that it's more effective and it's less invasive to do that. However, if you've tried that treatment and it hasn't worked for you, it is completely okay to use it in your 2nd and 3rd trimesters with providing very little risk potential to your baby. Most vaginal yeast infections clear up quite quickly in pregnancy. And this is regardless of the type of treatment that you choose, whether it's a pill or the vaginal cream or suppository. As I mentioned before, pregnancy is a state of disease. And so with that, it's important to know how long this course may be if you're getting treated. And I recommend that you be cautious and patient with your body because it may take a little bit longer for your treatment to clear up 100% compared to when you're not pregnant. And so I recommend waiting 10 to 14 days after your treatment has been completed before you have complete resolution of your symptoms. And so just be patient. Even if your treatment ended on day 7, it may take another week or so before you actually feel much better or much improvement. If you are breastfeeding, it is completely safe for you to use either options of treatment to clear up your yeast infection. And no worries, your milk production will not be affected by the treatments that you're receiving. So your baby's completely protected as well. So you may be wondering, well, doc, how can I best prevent getting a yeast infection while I'm pregnant? And so again, that yeast infection risk is high. However, you're in a state of vulnerability. It's easy for you to get infections overall. And so with that, I recommend the same precautions as you would take when you are not pregnant. And so the first is to be sure that you are wearing cotton underwear. I can be on top of a mountain and scream this, cotton, 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 cotton. And this is like 100% cotton because we know that it absorbs moisture. And one thing that will increase a ton when you're pregnant is vaginal moisture. And so while this is normal to happen, you want to mitigate that by wearing things that will allow your body to air out as much as possible. So cotton is really the best material to absorb moisture. Secondly, wearing loose clothing. This is more important in pregnancy, probably than not pregnant, because you want to really air out that area. So whenever possible, if you can be in loose clothing, it'll be best for the vaginal space. Now, I talk about these and much more in this video right here about all the things that you can do to help to decrease the likelihood of getting these infections, which will be just as important to you pregnant as well as not pregnant. So go ahead and check that video out. Lastly, I do want to remind you today to always seek the care of a provider when you're concerned that you're having an infection, especially in pregnancy, because it's very important that your treatment is appropriate for you, that you're not taking treatment that is not necessary, and that you're protecting your growing baby. And so with that, I'm so happy to be with you here today. It's been a pleasure. Check out all the other videos that I have here on yeast infections because there's so much to learn and so many different things that you can do to protect your body. Also, I'd like to welcome you to go ahead and click the link below to go to my website where you will find lots of information, blogs, details on how to help your body be its best. But in addition to that, I have a free gift for you. That gift is Hormones Don't Lie, and it's my ebook helping you to learn to navigate your body, your hormones, and how to enhance them so that you are feeling energized and feeling phenomenal. Thank you for being here with me today. I'm Dr. Perkins, a board certified OBGYN, and it's my pleasure, and I can't wait to see you next time. Thanks for being here.